My friends, this is Dr. B, the best doctor in medicine. 30 plus years of experience at high level in medicine. Today I want to talk to you, to all of you who are taking weight loss medications called semaglutide or tirzepatide, Ozempic, Wegovy, or Mounjaro, right? This is semaglutide, the brand name Ozempic or Wegovy, and this is tirzepatide, the brand name is Mounjaro. Mounjaro is more recent, came up recently in the market, right now August 2025. This is older. So you see now more doctors prescribing tirzepatide, Mounjaro. I am talking to all of you who are taking one of these two medications, whether semaglutide or tirzepatide. You need to make sure that your family doctor or any specialist who prescribed you any of these two medications sends you every 6 months, twice a year, as long as you are taking these medications, and also 6 months after you have stopped taking those medications, you need to ask your doctor to not forget to send you to do a thyroid ultrasound. The thyroid gland is a gland here at the base of your neck, right? Here, right? And that gland you can develop, you are at higher risk of developing thyroid cancer. Thyroid cancer, if you take any of these two medications, semaglutide or tirzepatide, it is very, very important to have every 6 months an ultrasound of your thyroid gland. A lot of doctors who prescribe these two medications do not send their patients to have a thyroid ultrasound every 6 months, and also 6 months after having no longer the patient under any of these two medications. They just either forget, or they don't know about it, or they don't care. I don't know. But if you take any of these two medications, you are at higher risk of developing thyroid cancer. Not just the regular thyroid cancer, because the regular thyroid cancer, which is called papillary thyroid carcinoma, PTC, is highly curable. But if you take any of these two thyroid medications, you are at higher risk of developing other forms of thyroid cancers that are high grade and more aggressive, more nasty, that can metastasize quickly to your body, and that do not respond to iodine, to radioactive iodine, which is what we use for the regular metastasis of regular thyroid cancer, right? These cancers, thyroid cancers that are caused by these two medications are high grade, or more malignant. I apologize, it's getting late. I had a long day. Malignant, higher malignancy, higher grade, more nasty cancers that can metastasize quickly to the rest of your body. And the only way to detect them early is to have every 6 months, means twice a year, to have a thyroid ultrasound. It's very easy to do a thyroid ultrasound. It takes 10 minutes. I'm an expert. Dr. B is an expert in thyroid ultrasound, right? In medical imaging, among many other fields of medical imaging. Dr. B has 14 licenses in America in medical imaging. 14 licenses I have that I have obtained during the last 30 years of practice in medicine, and it's the North American record. North American record. 14 licenses. So listen to me and trust me. Do not listen to the fake artificial intelligence doctor. Listen to me. This is for your own life. And understand that many doctors don't know this, don't care, or they don't remember, they don't have the time because they are too busy seeing other patients. They spend only 5 minutes with you in the exam room, and they are in a busy hurry to give you that prescription, kick you out, and get out of here so that they can see other patients. Do you understand? It is very important that you advocate for yourself, that you grab the bull by the horn and become a knowledgeable patient, and avoid the old days when patients were considering that the doctor is the God. They would trust the doctor 100%. They would give their body, their mind 100% in the hands of the doctor. I'm not saying you shouldn't trust your doctor, but you need to be alert. You need to be aware of your condition, of your disease, of what they are prescribing to you, of the side effects and everything. And never forget that any of these 2 medications, that if they prescribe them to you, you are at higher risk of developing highly nasty thyroid cancers, and the only way to detect them early and therefore make them curable before they have spread out of the thyroid gland to the rest of your body, especially your bones, right? You need to have an ultrasound and request that to your doctor if he forgot, or if she forgot, or if he doesn't care, or if she doesn't care. They might respond to you that the risk is very low. Okay, very good. But having low risk doesn't mean you cannot have it, right? There's a low risk of winning at the casino over there. But thousands of people every weekend go to the casino, and a lot of them, they win. And they win, some big, some a little, but they win. So having low risk doesn't mean it cannot happen to you. And when it happens to you, then you're going to regret that you didn't take the time to go have a 10 minutes ultrasound. You take the ultrasound probe and you put it here. I can tell you because I'm an expert, right? In medical imaging and in ultrasound and medical sonography and blah, 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 right? So listen to me. Have an ultrasound of your neck every 6 months. If you keep taking any of these 2 medications, so that if you are among the rare cases that there is a thyroid cancer caused by any of these 2 medications, at least it will be detected early. Then you can have the surgery and maybe some other treatment, chemo, radiation, radioactive iodine, who cares? We're not there yet. But you need to detect it early, and the only way to do it is to have a thyroid ultrasound. It takes 10 minutes. Then your doctor will send you, and you will have it every 6 months. Once you stop taking, if you decide to stop taking any of these 2 medications because you lost a lot of weight and that's enough, right? Or for any other reasons, who cares? If you stop taking it, the side effect, increased risk of thyroid cancer, will persist for the next 6 months. So you need to have, after you stop taking the medication, you need to have another last thyroid ultrasound 6 months after you stopped taking any of these 2 medications. Do not forget, this is your life, right? Remember that your doctor has medical insurance I apologize, has liability, professional liability insurance. So if your doctor makes a mistake or forget something, like sending you for every 6 months to check to have a thyroid ultrasound, and you develop thyroid ultrasound, your doctor doesn't care, because your doctor has professional liability insurance. So he's not going to lose any money, he's not going to lose his house, he's not going to lose his mansion, he's not going to lose his villa, he's not going to lose his Ferrari, his Mercedes-Benz. He will have a good life while you are suffering from the consequences of thyroid cancer and its treatment. So make sure that you become your own healthcare advocate. A patient nowadays, August 2025, cannot be ignorant. There's so much information online that you cannot not know about your own disease, not know about the side effect of your medications, and blah, 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 and blah, blah, blah. You need to play with your doctor to help him so that he doesn't forget, so that he doesn't neglect, right? And last but not least, if you realize that your doctor, your care team, your healthcare team doesn't care about you, doesn't give you what you deserve, doesn't take good care of you, they rush you in and out of the exam room, then you can change your healthcare team. There are dozens of good doctors like Dr. B who will listen to, I'm not advertising, right? Who will listen to you, who will take care of you, who will not rush you in and out of the exam room. Remember, 5 minutes is the statistical, is the average time a patient spends in the exam room with the doctor. In the exam room, official statistics of the American Medical Association. It's crazy. So if you find out that your care team, your healthcare team, doesn't give you what you deserve, doesn't care, they rush you in and out, my God, there's so many other good doctors who are caring, who really care about you, who don't see you as a money-making machine, who will take care of you as an individual, who will apply holistic medicine to you, who will tailor, custom-made, make these treatments to you. They will not put you with other patients in the same bag and apply the same care and the same medicine to all of these patients in the same bag. It is unfortunate, but it is 80% of medical professionals, whether medical doctors, whether dentists, chiropractors, whether nurse practitioners, whether this, whether that, they are all now thinking about the big mighty dollar. And all they care about is to make money, see a lot of patients, one after the other, bam, 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 5 minutes, 30 patients in a day, 40, 45, 35, 25 patients in a day, in and out, so that they can make a ton of money. There's obviously not just the greed of the medical profession, but also the huge number of patients that they have to see, the lack of healthcare resources, the lack of the overpopulations, just too many people in our country. We are 350 million people. We are the third most populous nation on earth after India and China, right? There comes the United States. Pretty soon, in 10 years, we're going to be 400 million people. There's just too much poverty, too much unemployment, too much homelessness, too many people with no insurance, too much inequality, too much wealth and poverty gap. And the doctors, a lot of them, even if they are not greedy, they have no choice because they have to pay their huge office rent, they have to pay their receptionists, the nurses, the overhead, and everything is going up. The cost of maintaining a private practice is rising the same way the cost of maintaining any business is rising because of just again, huge amount of inflation we saw recently under the other administration. And I mean, it's just crazy. The cost of living, food, gasoline, utilities, rent, mortgage, everything is going up, especially here where I live in California. So grab the bull by the horn. Don't entrust your body and your mind 100% fully to the doctor. Don't look at your doctor like the God, because he has his weaknesses. He forgets. He doesn't remember. He's in a hurry. He's in a rush. And he's not perfect. He's a family doctor. Even if he's a specialist, there's a lot of things they don't know. They don't have the time to learn and blah. It takes time for them to update their knowledge, and there's so much to do, and he's busy or she's busy running their family, their kids, their wife. They have to go on vacation to Europe and spend all the money that they made, and blah, 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 blah. So don't forget, if you are on any of these two medications, make sure you have a thyroid ultrasound every 6 months. It takes 10 minutes to do. And remember, 10 minutes is worth your health to not have a cancer or to detect it extremely early at a very curable stage. And once you stop, make sure 6 months after you stop, because the side effect is still going to be there, the increased risk of cancer, you have a last ultrasound of your thyroid. It takes 10 minutes, 6 months after you have stopped. I love you guys, regardless of your color, of your skin, your gender, your political affiliation, whether you're a man or woman, anything in between, black, white, Latino, any cat, so I don't give a cat. So whether you're a Muslim, atheist, Buddhist, Jewish, Hinduist, Islamist, I don't give a cat, so who you are. I love you. I give a big hug to you. Remember that Dr. B graduated more than 30 years ago from medical school, and I took the Hippocratic oath, and I promised, and I will never break my oath, never betray my oath, that I will never put my interest above yours. You will be always above me. I swear to God. I swear to God, I will never break my promise to you, my Hippocratic oath. Please put your comments and questions down there, and I will get back to you as soon as I have the time in my busy but lovely life. I love you guys. I talk to you in the next video, and thank you very much for your viewership. God bless you. Bye-bye.